It's time to sit back, relax, and listen to Change Your Attitude, Change Your Life. Change Your Attitude, Change Your Life will inspire, motivate, and empower you. Live your best life now. Listen, learn, think, and decide. Change your attitude, change your life. And now, here's your host, Joan Herman.
Welcome to Change Your Attitude, Change Your Life. I'm Joan Herman. Thanks for tuning in. Change Your Attitude, Change Your Life brings you interviews with some of the most inspirational and influential people in the world. It's our goal to educate and empower you so you can live your best life now. Thank you for taking time for yourself, and thank you for letting us be a part of your life. We have another great show for you today. Challenged by the limitations of her training to respond effectively to childhood trauma, today's guest, Dr. Pilar Jennings, took the unconventional path of integrating traditional therapy with Buddhist practices. She's here today to discuss why she took this approach and the benefits she had seen with her patients. Dr. Jennings is a psychoanalyst in private practice and the author of the book To Heal a Wounded Heart, The Transformative Power of Buddhism and Psychotherapy in Action. Welcome, Dr. Jennings. Thanks for joining us.
Thank you, Joan. It's good to be here.
So, Dr. Jennings, in your book, To Heal a Wounded Heart, you talk about an unconventional path in therapy. What made you decide to take this approach?
Well, as I was beginning the process of working with patients and becoming a therapist, I was realizing that my training had been extremely helpful. It had helped me think carefully and deeply about the many reasons why people come into therapy. But I was also discovering that there were certain limitations to what I had learned, that in certain treatments, the traditional approach of listening carefully and creating a lot of space and being empathic and non-judgmental was offering needed support, but wasn't necessarily helping my patients feel better and really start to heal from their traumas and their various forms of suffering.
How do the two practices work together?
I think there are many different ways in which the traditions can come together. For me, it has something to do with how I'm listening. In Buddhist training, we come to discover that people have what's described as Buddha nature. And you don't have to be a Buddhist to imagine that there's a part of oneself that's very wise, that's insightful, that has a lot of compassion for suffering, including one's own and others. And so as a therapist, I was trying to find a way to appeal to that part of each patient. And insofar as both traditions really want to be very respectful of a person's ability to have insight and to heal, I felt that concept of Buddha nature was really adding another dimension to what I had been trained to do as a therapist.
Doctor, what benefits do you see from offering care in this way?
I have found that patients start to trust themselves more if they're working with a therapist who deeply respects their ability to have insight and to understand their own experience. Traditionally, analysts have had what's sometimes described as a hermeneutic of suspicion, or a sense of knowing the patient better than the patient knows themselves. And in my analytic training, because a lot has changed in analytic theory over time, very much supported by my Buddhist training, I really believe that each patient has the ability to access their own wisdom, their own insight. They just need someone to affirm that it's possible and to orient them toward those resources.
So your book deals with healing a wounded heart. How do you describe trauma? What does that look like in someone's life?
Trauma can look many different ways, but generally speaking, it's any experience that leaves somebody feeling excessively stressed and in a way that overwhelms their ability to cope. so that's a real simplification, but it gets to the heart of trauma, which is a sense of something happening that cannot be dealt with in the way one normally deals with stressors or difficulties. And it can leave people almost feeling undone by what's happened.
Are there different kinds of trauma?
Yeah, there are the more acute traumas such as accidents or war, a violent assault of some kind. But then there are the so-called micro-traumas of being treated in a way that is really misattuned to the reality of who someone is. And so, for instance, a child being raised by someone who really doesn't get who the child authentically is. It's almost the experience of repeated micro-trauma, repeated feeling of being left on one's own because the person we're closest to isn't able to find us emotionally.
Doctor, what do you believe enables one person to manage the impact of trauma differently than another? So, for example, two people who experience the same situation, why does one move forward while another gets stuck?
It's a great question, Joan, and it's such an important one. I believe, based on my clinical experience and my personal experience, that we all share the same capacity for healing, but we need certain conditions in order to heal from trauma. And one critically important one is having people in our life who really actively want to help, also can simply tolerate what's happened. They can hear about it. If it's a death, if it's a sudden illness, it's not too much for them to be curious about. And what can make a huge difference when someone's trying to recover from trauma is simply having people who have an open mind, have a spacious mind, so that there's somebody else helping us hold what really can be too much to hold on one's own.
Doctor, about 8 years ago, I went through significant loss. In a period of 6 months, I got separated. My marriage ended. My mother died. My sister died. They were my remaining nuclear family members, and my oldest son left for college. And so I had this life one day, and the next day it was gone. And it was a significant loss for me. So I know personally all of that loss, it changed me. I am a different person today because of that. So how do you believe loss changes us, and how do we heal? How do we begin that healing process?
Well, first, I'm sorry, because I really hear the overwhelming nature of all of those losses in such a short period of time, Joan. And I empathize because I know also that experience of your sense of self getting radically changed. Right? Because we're relational beings, our sense of who we are is formed through relationship. And so when we lose primary relationships to a parent, to a child, to a lover, our sense of who we are will radically change. And this is not inherently a bad thing, right? Because new parts of oneself can emerge. I know in my own experience of losing loved ones, I discover aspects of who I am that were there, but really hidden, really in the shadow.
Right.
And sometimes that can be enlivening, right? I mean, even if it's a newfound sense of aggression or the ability to speak truth to power, whatever it is, or tenderness. But it's a lot to go through, and so I encourage your listeners who might go through something similar to be extremely patient with their own healing process, because when our sense of who we are gets reorganized, it really takes time to just get the lay of the land, right? Figure out what's going on and who we are.
When someone is going through such a difficult challenge, or really any type of challenge, how does he or she know when therapy is warranted?
I think this is a personal discernment for each individual. But there are some signs that are important to notice. One is any tendency to isolate. This is a telltale sign that some support, some intervention is needed. Again, because we're relational, because everything about us happens most fluidly, most successfully in the context of relationship. If we're withdrawing from relationship, that usually means that we're having a hard time. If we're not able to function as we normally do, to go to work, to take care of our child, to pay our bills, again, it's another sign that probably some therapeutic support is necessary. And then certainly if there are any compulsive or addictive behaviors, which is very common, because when people are going through loss, they're usually trying to just self-soothe. So food and alcohol and sex, etc. These are various ways to find some immediate soothing. But if they become problematic in and of themselves, and they often do, it's just another indication, it's another little flag that therapy will probably be very helpful.
Doctor, are there any changes that you would like to see occur in the practice of psychotherapy?
Yes, there are. I mean, as much as I deeply respect the tradition, and I think most people would benefit from being in therapy, I would like to see the tradition emphasize the importance of compassion more, both for therapists and in their training specifically, because right now there really is no compassion training for psychotherapists, and to help therapists support patients in cultivating more compassion for themselves, for their suffering. Ironically, in psychotherapy, it is just hoped, it's assumed that future therapists will be compassionate with their patients, but they don't actually get any specific training for it. Now, the field tends to attract people who care about suffering, their own and others, and often they can naturally be very empathic, but not always. So I'd like to see that really emphasized in therapeutic training.
The book is To Heal a Wounded Heart, The Transformative Power of Buddhism and Psychotherapy in Action by Dr. Pilar Jennings. If you would like to get more information about the book or Dr. Jennings' work, you can visit drpilarjennings.com. That's drpilar Jennings.com. Dr. Jennings, in our final moments, what would you like to leave our listeners with? What's the takeaway?
We all go through times of suffering and quite a bit of loss. This is part of the human journey, and so is our ability to navigate these experiences. Our ability to cull meaning from our losses, even to go on and thrive, is very possible.
Dr. Jennings, thank you so much for being here with us and for helping us manage loss and suffering. You've provided some wonderful strategies that can help us navigate these experiences so, as you said, we can grow and thrive. So thank you for being here.
Thank you, Joan. I've really enjoyed it.
This is Change Your Attitude, Change Your Life. Stay with us. We'll be right back. Thank you for joining us. I hope you found the show informative. At Change Your Attitude, Change Your Life, we believe that knowledge is power. Take what you've learned, apply it, and live your best life now. Remember that the information provided are the opinions of our guests and should never replace the advice of a professional who knows your personal situation. If you'd like more information, visit our website, CYACYL.com. While on the site, listen to past shows on demand, read our digital magazine, take part in the book club, check out our team, and be sure to follow the show on social media. Until next time, this is Joan Herman. Thanks for tuning in.